Yeah, so I wanted to share this quote that is very relevant today as it was about 65 years ago, or 55 years ago. So of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. A quote that sounds probably familiar to a lot of my healthcare activists. I've seen it several times. But as we are really in, kind of reaching a high of this battle for AB 1400, this quote came back up and I thought of it that yes, all the forms of inequality, injustice in healthcare, because you are taking advantage, it's an injustice to provide unequal care or, unequitable care to someone in their time of need. When you can still discriminate when someone needs help, a human being needs help, and you still are okay discriminating against them because of the color of their skin, their income, maybe their religion, anything like that, and you are still in their time of need, they are sick, and you can still discriminate against them. That is truly inhumane. That was spoken by Dr. Martin Luther King Jr. at the second annual convention of the Medical Committee for Human Rights in Chicago, March 25th, 1966. That was about 2 years before he was unfortunately assassinated. And still to this day, we are still fighting that same fight. And it is getting even louder. That message is getting louder and louder and louder. It is not going away. We cannot just piecemeal it away. We have to address the injustice here and now, and we have the opportunity with AB 1400. So with that being said, what is AB 1400? For some of you or anyone who's watching out there in Facebook Live land, who are just now hearing about this, maybe you heard about it on the news. Last week, we were getting some actual press. We actually got news. We've only been talking about this for over a year, but for the first time, I was seeing it in LA Times. I saw it on KTLA. I saw it on CBS. So we actually made the news. Mainstream media paid attention, and the first thing they decided to talk about was what? Taxes. They didn't decide to talk about what AB 1400 covers and how it will be great for the greater good of all California. They want to talk about taxes, but I'm going to tell you what AB 1400 actually covers. So it is very simple, very, very simple. And I'm going to kind of free talk for a minute as I'm waiting for Zoom to load my screen. Zoom has been, being very, very slow with this. So the 7 basic principles. Can I get a thumbs up from somebody? You guys can see my screen. Cool. All right, so CalCare 7 basic principles. This one-sheeter was brought to us by CNA, who is the champion of this bill. And so I want to thank them, shout out to them, because nurses are the #1 trusted profession 20 years running, and that is based on research. #1 trusted profession, nurses, we rock. We kind of know that, but I just have to give it to us again. We rock, even though half of us are rethinking our career due to COVID, but we do really still care about our patients, even though we are kind of really rethinking our careers. So what is CalCare? CalCare is the solution to our broken healthcare system. It is guaranteed healthcare as a human right. In the state of California, by providing comprehensive, high-quality healthcare to all, just like Medicare for All would do nationally. This provides universal coverage. You will hear us say it time and time again. Everybody in, nobody out. That is a chant that we like to use. Everybody, regardless of your race, sex, gender, country of origin, disability, immigration status, which I know Gavin just gave, Medi-Cal to all immigrants in this past week too, saying that everyone should have universal access to care. We'll talk about that later. But it guarantees you care regardless of your marital status too, and income. You get the care that you need regardless of your ability to pay, whether you can pay now, whether you can pay later, whether you got millions in your account, maybe your account's overdrawn. You're going to have universal coverage. A single public program. This is the program of the people. The people, you, me, us, together. A single publicly funded through progressive taxation, we're definitely going to talk about that, to cover all necessary care in California. We're going to eliminate billions and bloat and waste and save you thousands on your healthcare costs. We're going to provide fully comprehensive benefits, more, even more than Medicare covers right now. This includes your medical, dental, because Medicare doesn't cover dental, hearing, vision, mental health. Most insurances say they cover mental health, but it's sketch. Prescription drugs, long-term care, Medicare doesn't cover long-term care, by the way, and more. All decisions about your care will be between you and your doctors and not the insurance companies. AKA, you don't need an insurance company telling your doctor that they can't make that decision to treat you because they felt like it wasn't the right decision that the doctor decided. What? Anyway, you're going to have a freedom to choose your care provider. No more of this, I love my insurance because I get to go see my doctor. Well, no, you don't love your insurance. You love your doctor, which is great. I love for patients to have a really good relationship with their doctors because that means you listen to them and you trust them. But that doesn't mean you love your insurance. If your doctor is under CalCare, you're going to see them still, regardless, whether the insurance is there or not. So there's going to be no more in-network or out-of-network. Maybe your doctor decided to change networks. And that happens a lot. Doctors' offices, medical groups, they change networks like Sunday going south. Sometimes they accept this plan, then next year they don't. And that means you may lose access to that doctor you love, but under CalCare, you wouldn't. You will have the freedom to choose any doctor or hospital you like. So you won't be stuck with a doctor or a medical group that maybe you don't like, maybe that's not providing the best care or service to you. You will be able to change them without having to worry about network. So this is going to be free at the point of service. So we're not talking about any more copays, premiums, deductibles. You're going to arrive at your doctor's office. You're going to show them your CalCare card. You're going to have a seat. And yes, you will still have to fill out those forms. I'm sorry, can't get around the forms. You will have to fill out those forms, but you won't have to pay. So that's good. So have a seat, fill out the form, give the form back, go see your doctor, and then go home. Okay, cool. Just transition. We're going to provide funding and programs to protect and support any displaced workers in the insurance industry. As someone who has worked in that industry, I can tell you, I definitely care about these people because I know these people. These people have faces, names, and families to me. They are not just numbers. You are going to hear politicians talking about the displaced workers. Well, we'll think about all the workers who won't have a job. Oh, yes, they will. They'll probably have a job in CalCare because plenty of those types of jobs, what they're doing, what the front line is doing, is definitely going to be needed in CalCare. We're still going to need people to process claims, even under a single payer. We're going to need people to do it. You know, single payer is not going to be automated. We're going to need people. So we're going to need those people. So we're just going to steal them from the insurance industry. Come work for CalCare. And guess what? You won't even have to pay for insurance benefits because why? Everyone's going to have the same thing. Yay. And then finally, you're going to get patient care based on patient need. No more financial incentives to avoid providing necessary care. What does that mean? Isn't there regulations already against that? Yes, but it's sneaky. So financial incentives means contracting with certain providers because of rates, not because of the service they provide, not because of their outcomes, but because they have good rates. That's the first thing that these insurance companies are looking at when they're going and building their networks. They're looking at the rates providers are charging, not necessarily, oh, what was your last year's outcomes? Not that, how many admission rates? Yeah, that's about number 3 or 4 in the conversation there. So that's what patient care based on patient need and how they have financial incentives to avoid providing necessary care. If the rate, they will send you to a lower rated, or a provider who has, charges lower rates than a higher tier provider that because of that may be able to accommodate your care because that rate structure, that payment structure. So that is the financial incentive that is happening right now, each and every day. And that is your 7 basic principles. And so I'm going to stop my screen share. And so I want to go in and see, Paul, do you want to, I'll give it one more shot really quick. If we can get that commercial going before we jump into the appropriations talk, because we're going to run pretty tight after that one. So while we're waiting for this to show, I want to introduce my co-host and who's going to help us lead the conversation, especially about the appropriations in the process, Ryan Skolnic from CNA. And it looks like we might have this going. Paul, unmute yourself.
That I desperately need.
Our deductible is so high, we can't afford to see a doctor when we need one.
Our co-payments went up, so we're putting off seeing our doctors.
I love my doctor. I hate my insurance company.
AB1400 means no more insurance companies. Visit healthcareforall.org to make it happen.
Yay, thank you. All right, that worked. Thanks so much, Paul, for sharing that with us. But yeah, so I want to introduce from CNA Ryan Skolnic, who is my policy partner. I have application. I can tell you how this stuff applies in the world as it is right now. But when it comes to digging and getting deep into the policy, sometimes, we reach out to our policy partners, AKA Ryan or Phil. So I want to introduce Ryan. Feel free to come off mute. But what we're going to do, we're going to talk about where we're going with appropriations and where AB 1400 is, and the kind of, maybe it sounded like it might be an uphill battle, Ryan, coming through appropriations. So what are your thoughts on that?
Well, first, hi, and thank you so much for having me on. And before I say anything about appropriations, I want to give a very sincere thank you from us at CNA, because that AB 1400 does not even get to appropriations without the hard work that activists like you have been doing throughout this state, from LA all the way up to Northern California. It has been an all-out press everywhere. The bill is a very tight timeline, and this bill does not clear unanimously in terms of the Democrats, minus Mainshine, who is barely a Democrat. He was actually a Republican and who switched to Democrat. But anyway, I wanted to say thank you all so much for the calls, the contact, the ledge visits. Everything you've been doing has led up to this moment. And now, as you noted, we are at appropriations. Now, I want to talk for a quick minute about what the Appropriations Committee is and how it works. And then I'm going to talk about what we can do to optimize our chances of AB 1400 clearing appropriations. So appropriations is one of the two major fiscal committees in the legislature. You have the Committee on the Budget, which deals with the actual annual budget, but then you have the Appropriations Committee, which deals with the cost, the fiscal impact of every other bill. So the Appropriations Committee hears at basically almost as many bills as all the other committees combined, because every bill that in the Assembly that costs, well, actually, I'll get to that in a minute. But basically, any bill that has a fiscal impact of any sort will go to the Appropriations Committee. It doesn't matter if that bill includes financing or not, if the bill itself raises costs in any way, shape, or form, or reduces them, it goes to appropriations. Appropriations does not work like a policy committee. If, for those of you who paid attention to how AB 1400 went through the process, Chairmember Jim Wood, who we're very thankful decided to get on board the bill and helped it get through. He introduced the bill. Ash Kalra, the main legislative author, spoke. So did co-author Miguel Santiago. You had witnesses for and against, and then you had public comment, and then you had questions from the hearing, from the different members of the committee. That is not how it's going to go in appropriations. The Appropriations Committee has a different mechanism, and it's called the suspense file. And what that means is any bill that in the Assembly and Appropriations that is going to cost an annual amount of $150,000 or less. In the Senate, it's $50,000. It doesn't matter what the considerations are, it will automatically be what's called placed on the suspense file, which basically means it's frozen in action. Then what happens is all suspense file bills are dealt with in one massive hearing, which usually happens towards the end, which will happen towards the end of the month. And in that hearing, there's not going to be testimony. There's not going to be feedback. The committee is going to just dispense with every bill in suspense, which is going to be hundreds of bills. Now, how does it do that? It's done behind the decision on what will happen to each bill is made behind closed doors. And that decision is made by the chair of the Appropriations Committee, Chris Holden, in the case of the Assembly, some legislative leadership, and then ultimately a vote behind closed doors of the members of the committee. So when that hearing happens, it's rapid fire. They just rapid fire off a list of bills, and one of three things will be said about each bill. Either one, the bill gets out on a roll call, which means that the bill had support of both Democrats and Republicans, and it was allowed to advance out of committee. Two, the bill is out on a B roll call, which means only the majority party, in this case, the Democrats, voted to move it out. If our bill is going to clear appropriations, it will be, you will hear AB1400 gets out on a B roll call. Or it will be, this bill is held in committee, in which case, since this is the second year of a 2-year bill, that bill will die in the case of AB1400. So you're either going to hear gets out on a B roll call, which means it moves on, or held in committee, which means the bill will not advance this year. Now, the theoretical reason for doing it this way is there's a ton of bills that cost different amounts of money. So the suspense file, in theory, allows the Appropriations Committee to take a holistic picture at every different bill that costs money and then prioritize which ones they want to send to the floor for a vote. In reality, it's a way for leadership to quietly kill bills. Now, so that way they don't have to take a public vote on it, because if a bill is held in committee, there's no record as to who made that decision. There's no vote or anything. Now, what does that mean in terms of our campaign to pass AB 1400? It means that the work needs to be done now. And there are a few different things that everyone can do to help advance AB 1400 through appropriations. The first is, and we've talked about this, if you were on our strategy call after the hearing last week, you'll have heard these already. The first is, if you are a member of an organization, like all of you on this Zoom are, HCALA, if you're a member of any other organizations, they should submit letters to the Appropriations Committee as soon as possible. The reason for that is, even though these letters are not included in the committee analysis like they were with the health committee, they are still going to be read by the chair, Chris Holden, and the other members. Gina and I were talking just before the Zoom started, and you're not going to have a torrent of letters from the opposition, but the opposition that does send letters in, it's going to be very powerful opposition. You have Kaiser, you have the California Medical Association, you have all these major groups that are sending in big all these intense letters that are very powerful. So if we have as many people as them, obviously it's not going to be in our favor because they have more money than we do. However, if they have 10 opposition letters and we send in 200, that's where things make a difference. So if you're a member of an organization, you should submit a support letter to the Appropriations Committee, and that should be done ASAP. I see that Erica posted the link to do that. It's bit.ly/AB1400 supports. So
we'll drop this on Facebook in the Facebook comments as well.
Yeah, and it'll be put on Facebook. So that's, if you're a member of an organization, that's the first thing you can do, because they do read these, and the more in favors they hear, the more likely they're going to feel that pressure and move it on. Second is, you're going to want to, in general, contact your own assembly member, and only yours, by the way. Assembly members don't give a damn what you think. If you are not their constituent, it'll actually just annoy them if you are not, if you try and call their office and say, no, I'm not a constituent. So call your member of the assembly, especially if they are a Democrat that is not co-authoring the bill currently. The list of co-authors was just updated recently. Mia Bonta, Isaac Bryan were both added to it. Wendy Carrillo, who's been a co-sponsor from the get-go, her name is finally on there. So you should call with a high road ask, and I emphasize high road. The bill has made it as far as it has, in part because leadership is not actively hostile to it, as far as we know, in the same ways they were 562. And a big part of that is there's been a lot of work to work with these people, and that is why the bill is as far as it is. So high road ask to call your legislator and ask them to support the bill. And then finally, if you want to call with us, call people in important districts, we're actually hosting a few phone banks. One of them on Tuesday, one on the 18th, and one on Wednesday, the 19th. I see that Erica posted the link to those as well. But if you want to sign up for those and help call people in critical districts and have them call their members of the assembly, that would be a major help. Again, that link is going to be in the chat on Facebook as well. And then I see really quickly that Chris asked a question, does it matter if the organization is not political? No, it does not. In fact, it might actually be better that way. The more nonpartisan organizations get behind AB 1400, the better. So if you have a mutual aid organization or a business and you want to send a letter in support, please do. And remember, do it ASAP, because we got to get those letters in. The bill will be referred to the suspense file in a few days. And then we'll put a call out when the hearing's going to be, so y'all can watch it. Of course, we can't influence it, but we can watch how it goes. And then finally, stay tuned for state Senate plans in the event we clear the assembly. I have no insider wisdom as to the facts of this. I'm just giving a conjecture opinion of my own. I think if we clear appropriations, we have a decent chance of passing the floor. I really do. And if we do clear appropriations and clear the floor, we'll have to do this all over again in the Senate. So, and let's hope on that happening, and let's continue to work as hard as we can. I know it was a lot to take in. The appropriations process is really arcane and confusing. So if there are any questions, I'm happy to answer them. But long story short, this is going to be behind closed doors. The work to get it passed needs to be done now.
Thank you so much, Ryan. And that's why I asked Ryan to come, because I knew he was going to simplify it and give you way more information than I could have given you. So thank you so much. But we do have a question. Miss Marge, you want to come off mute? Or
Hi,
you are?
I think I'm unmuted. Yes, I'm from San Diego County and working really hard down here to get things through. However, we just have one district, the 77th, represented by Akia Weber. That's Shirley Weber's daughter. She is on the Appropriations Committee. So I'm really working hard to get all those people in that assembly district to write, call, and whatever. But you did say it's best then to just call our own person I'm in the 76, and she is not right now is not for this bill, but just keep calling and keep writing, even though they aren't on any special committees. Did I hear that right?
Absolutely, because once the bill clears appropriations, it'll have to go on the floor where every member of the assembly will be voting on it. And you can bet that the insurance, drug, and hospital corporations are already doing whip counts of all legislators, assuming that it will clear appropriations just in case. They'd be foolish not to. Okay, so great. We need to be getting on that now. And remember, I got to emphasize, high road ask, because we have built quite a bit of goodwill. There's a lot of animosity towards the concept itself, but even our opponents have begrudgingly admitted that this time is different, because they won't say this, but it's because there's a lot more pressure. But it needs to be high road pressure. We want to bring them along with us. And so far, we've done a good job of that.
So one last thing, Lorena Gonzalez was the chair of the appropriations, but she, as you know, resigned. She's from San Diego County, the 80th district, and she resigned, to go with the California Labor Federation. The new person, Holder, do you know anything about his feelings towards single payer?
I don't think anyone knows for sure, because he's never had to take it up before. We know that the decision is not just going to be made by Holden, although that is a big part of it. It's going to be made by assembly leadership in general. So I think that it's important that everyone continue to call their member of the assembly. I think it's important to get those letters in ASAP. I think that Holden will ultimately make his decision based on who he feels more pressure from, the insurance, drug, and hospital corporations or us. So.
Okay. And how soon will we know the results of the appropriation vote?
It will be before the end of the month, probably the Thursday before session ends, is when the suspense hearing usually happens. That's not a hard date. It could be different, but that's often when it is. We will put a blast out, I'm sure, when the actual hearing date is scheduled. We know that I believe it's was it the 20th? It's going to be in a few days that the bill will be formally referred to the suspense file. That's going to be a different hearing than when we find out whether it gets off or not.
Thank you very much. And thank you all for all your time. And don't write us off down here in San Diego. There's plenty of us that are with you guys, okay?
Oh, never. We know we know we've got support down in the South. Dr. Keela Weber, I was hoping that she would be more of a champion on this.
Yeah.
But I once again, high road ask. Erica, go ahead.
Hi, Ryan, thank you so much for being here today. Always appreciate it. I'm wondering, can you talk about, I understand that we have to get every single Democrat in the Appropriations Committee to vote on this bill. Can you confirm that? Can you tell us who do we have for sure on our side? Who might be persuadable? Any information like that?
So I know that Wendy Carrillo and Isaac Bryan, who are both co-authors, are on appropriations. We don't necessarily need every Democrat to vote to advance it. We just need enough. So the way it works behind closed doors, obviously, is the bill will be held in committee if it doesn't have the votes. So that's one possible outcome. And if the bill is held in committee, we won't know if it's a hold-in decision, if it's other assembly leadership, if the leadership decided they wanted to move it out, but it didn't have the votes. We just won't know. That's one of the frustrating things about the suspense file process. It's I have very strong opinions of it, but all I will say is that if we don't have the votes, the bill will not even, it'll just be held and we won't know why. So I think, we just need we'll need a majority as well as the favor of Holden and the leadership, which is why getting those letters in as quickly as possible. And we have a template. It's a similar template to what we used to get health committee letters in. And by the way, one more thing. If your organization sent a health committee letter in, but not appropriations, you need to resubmit a new letter to the Appropriations Committee. They do not transfer. So make sure if your organization has sent one in for health, but not appropriations, you use our new template and send one into appropriations as well.
Awesome. Thank you so much. Yeah, each committee has to have a new letter. And then also you have different people in different committees. Some are same, some are different. So, each committee we hit a new letter. Once we hit the assembly member gets a new letter. Lots of letters here, lots of love. But like I said, keeping it high road, because like Ryan said, we have actually gotten a lot more, I think, reception. And I think it's also because I remember hearing, assembly members, Ash and Miguel talk about how they do have a challenge. And I'm not defending money in politics, but I do understand. And I understand what it's like to stand up to a big beast and be the little David to the Goliath. I understand that. I understand that when you run for office and you've worked so hard to get there, and then we ask you to stand up for a bill that a lot of people are against, and that a lot of big interests are against, that could completely annihilate any political future you have. I understand that is scary. But what's scarier is seeing people die, which I have numerous times from preventable conditions, a lot of it due to lack of care. And AB1400 is one prong of a multi-prong solution to our broken healthcare system, but it's a big one and we really need it. So I am asking all those assembly members and all those senators to stand up to Goliath, because guess what? 80 rocks will, if one rock took down Goliath, 80 rocks is really going to take down Goliath. So that's why I'm like, one rock might not take him down this time, but 80 will. So 80 votes, 80 rocks going up against Goliath, you will win. And then you've got the millions of us behind you. So just really quick, want to go to the chat because I saw something from Robert. He asked, should we still call our assembly member even if they're our co-author? It wouldn't hurt to say, hey, thanks so much. Like I said, going back to showing that love, just knowing that, hey, they are the little Davids in this story. They are throwing their little stone, and they are going up against their coworkers. Like, this is some workplace hostility from what I've been hearing from the inside of the assembly, the things that have been said to some of them from their coworkers. I would be reporting that to the union, but nonetheless, they are getting some heat. So yeah, I think it's appropriate to just let them know, let their staff know, you know what, I appreciate you, continue fighting this. It just kind of, like how we felt when we passed health committee and we were like, yes, that fire, knowing you're appreciated really does kind of like, give you a little gas burner to just, burn a little brighter. And then I see that you also mentioned that one assembly member said that AB1400 was the worst bill they have ever seen. My thing is, how many contributions have you gotten from Blue Shield?
That was Heath Flora, one of the like 3 remaining Republicans in the assembly. So him and Cunningham, the other major Republican who have been discussing this, they're not holding back when it comes to this. But
no,
yes.
And I had a great talking point for Jordan Cunningham. Like, once again, reason why Gina can't run for office is because Gina and Jordan Cunningham may have not have had the nicest time in that committee. But he asked about Medicare. He asked about, what about all my constituents that are under Medicare that I have to represent? And I'm like, well, guess what, Jordan? They're paying for Medicare right now. They're paying at least $140 something for Part B alone. So what about all of them? And you're telling them you're going to actually give them their money back? Oh my God, that's a concept, isn't it? Sorry. Anyway, I'm going to go back to the questions that are probably for Ryan, and I'm just taking up time. Sorry. All right. From Carol Fedora, she asked, after we have called our assembly members, do we call the Appropriations Committee before the Thursday, January 20th?
So if you're members on the Appropriations Committee, absolutely. If not, instead of calling the different members, I would recommend taking part in one of our phone banks, which we're going to be calling people in those districts and have them call their members. Remember, assembly members will not listen. They may actually get annoyed if a bunch of non-constituents are bombarding them. I understand on a committee that their vote's important, but strategically, it makes more sense to focus our calling time on making sure that their actual constituents call. So I highly recommend joining one of our 2 phone banks this coming week if you want to make phone calls and have their constituents make those calls to appropriations instead. That's a much more effective use of time.
Ryan, I want to say one thing about that. This is Maureen. Hi there, everybody. When I called the health committee members, I think only 2 asked me my zip code. Other people didn't ask me anything. They just said, okay. I mean, so they didn't know if I was a constituent or not a constituent. They didn't ask me. So I don't know.
Either way, that may be the case. Probably still a better idea to not take the risk. I mean, if they take the call, then great. I've had that happen once or twice also. But I just think I just would be cautioned against too much of it, because the moment they feel like their constituents aren't the ones making the calls, or the moment they're able to dismiss all the calls outright as, oh, this isn't what my constituents actually think. That's a line that the conservative Democrats use all the time. Oh, it's just those progressive activists again. My real world constituents don't actually think this way. So being able to have people in their district call and be like, hey, I live here. This is you're my representative. I want you to do this. That matters a lot more than having just people all over the place from all over the state calling.
Yeah, votes carry weight, and we're going into an election cycle. So, this is, if you're going to leverage your vote, this is the time to do it. Oh, I hope that the LACDP didn't hear me say that. Anyway, so I wanted to ask Gina a question, and this is probably Ryan may have to take off the CNA hat. This is a Ryan question. If we don't get out of appropriations, and what do you think? How could we bring back AB 1400? Because I've said it from the beginning that look how, like, SB 562 2017, here we are 2020 or whatever, 2021, here we are with another bill. So we're going to keep coming back. And so if we, get put in, stuck in suspense, literally we're held in suspense in appropriations. What do you think what we can do other than, I'm sure I would want to burn things down, but I don't recommend that. Put the knives down, pitchforks down. But what do you think that we could do to bring back this fight again?
So one thing I will say is we all remember what happened after SB 562 was shelved. A lot of us were outraged over it. I was just as outraged as anyone else was, and things got really heated. And I think that indignation and anger is 100% justified because this is not a game and people's lives are at stake here. At the same time, I know that there was a lot of lingering bad blood that had to be overcome for the bill to get to even where it is right now, the current bill. And I don't think that that's the route that any of us want to go again. We don't want to repeat this process again and again because we don't want it to be known as, oh, here comes the single payer bill that the moment it's killed, everyone's going to start throwing death threats. Not that anyone will. But my point is that we would be better served focusing, because at the end of the day, bills die and are brought back all the time. And as far as I'm concerned, and I'm speaking kind of with my CNA hat, but mostly this is what I genuinely believe, is that bills die and come back all the time. But at the end of the day, if a bill is not successful, it means our movement was not yet strong enough. And the solution is to keep building the movement, keep talking to people about single payer. I don't know what exactly will happen. I'm not even trying to think about it because right now my focus is on getting this bill signed into law and implemented. But in the event it's not, whatever comes after, I'm sure will be all about continuing to build the movement. So if and when the next bill comes around, we're more ready than we ever were. So don't think that it all lives and dies with one bill. I mean, obviously we're fighting like hell to make sure this one happens, but the movement must go on, I think is what I'm trying to say.
Absolutely. And thank you for that. I agree. I think that, I think it would be a true reflection. It would be a poor reflection on the California, California legislature altogether to do this during a pandemic where we've lost so many. But like you said, the movement will go on, and this is the song that never ends. I'm like, if you want to get rid of me, pass AB 1400. That is the fastest way to get me to shut the hell up. Because if we are wrong, if the thousands of us who have been mobilizing across this state are wrong, then passing AB 1400 will be the best way to shut me up, to shut us up, to shut the nurses up. And we've got big mouths. That's the best way to shut us up. If you are wanting us to shut up, pass AB 1400 and prove me wrong. And I'm being dead serious. Prove me wrong that this system won't work by allowing this bill to pass, allowing your friends to build the board. I mean, the governor, the speaker of the assembly, and the Senate get to appoint the board. So prove me wrong by allowing your friends to appoint this board to build this bill, because Gina doesn't get appointed to the board. If I got appointed to this board, then man, I would be shocked. I would be very happy if Carmen Comsty gets appointed to the board. Lord, make that happen. But prove me wrong. So that's what I'm saying. It's like, if the assembly members who are in such opposition of this really want us to shut up, I think that they should vote yes and prove us wrong, because that will shut me up. Then I'll be like, well, I really got to go back to my drawing board at that point. And then I see let me just make sure I see Betty, you have your hand up?
Yes, I do. Hi, everybody. I have a question for Ryan. It's regarding the ACA 11. Like you said, like somebody said,
because that's going to move us right into our next topic.
Phil said it was an unfortunate name. That's everybody out there. It's Assembly Constitutional Amendment 11. But it will ultimately confuse people. That's just what we like to do in single payer, Medicare for all, healthcare for all, guaranteed land. But my question is this. From what I understand, it needs 2/3 of the legislature's vote to become a ballot measure, right? Because we're going to need a ballot measure because of the taxation. I also understand that 8%, if 8% of signatures, 8% of the last gubernatorial election voters, how people that voted during the gubernatorial election, if 8% of those are collected in signatures, it goes to the ballot. What are your ideas and your your opinion on that strategically? Because in my opinion, I'm thinking, well, if it passes, if this AB 1400, when AB 1400 passes at the end of this month, that we could start a little campaign of going around with petitions for signatures, because I think it's under 1 million, and really educate the public while we are collecting signatures. And we can even do it in hopefully if this Omicron gets over, do it in other town hall type of forums. So just kind of I want to know if I'm correct, and what do you think about it?
So there's a bunch of different things there, but first, let me say that that ACA 11 is not the only way a constitutional amendment is not the only way to do financing for CalCare. This is first and foremost, and you've heard Carmen say it on the activist call, and you're going to hear me say it. It is a starting point. This is the thing that unlocked AB 1400 from the Chamber of the Rules Committee. The reason the bill was sent on is because that was what was said. You give us financing, we'll move forward. And that's what ACA 11 is. It's not intended to necessarily, although it might be, the final product. The idea first and foremost is ACA 11 is the starting point of a robust discussion on the best way to finance a single payer system. This one happens to address a lot of common criticisms. Prop 98 and the GAN limit are both addressed by ACA 11, but that amendment is not, and a constitutional amendment in general, are not necessarily the only ways to do it. So I think that in terms of everyone going out and getting the signatures, it's more than just trying to get a ballot initiative to fund the bill in place. Because remember, AB 1400 does not take full effect until it's fully funded. So even if we didn't pass ACA 11, AB 1400 did pass, all that happens is that bill just sits on the books until we do pass something to fund the bill. But we need to, I think the thing is, and I know that Gina is going to bring up the taxation stuff in just a minute, so that's an important conversation. But I think the reality is that whatever is that, it's not just getting something on the ballot, it's also allowing AB 1400 to move forward. So that's why it was done through the legislative process rather than a citizens initiative, because they wouldn't have had the same effect of allowing AB 1400 to move forward. Carmen talked about all this. I keep saying that because I want you all to attend our activist calls when they happen. They're really good. We always have really great people on them, especially Carmen, who I think should be president of everything, to be honest. But at the end of the day, ACA 11 may pass the way it is now. It may look entirely different. It may not even be a constitutional amendment by the time it's over. Who knows? The reality is that as we've talked about, the process is policy can be figured out as we move on, the finance can be figured out as we move forward on the policy and after the policy is implemented. It doesn't have to be done right away. So I think that ACA 11 is a great starting point. And I think that as it does go through the legislative process, it's going to be a useful tool to move AB 1400 along as well. I mean, that's why it's moving where it is so far, if that makes sense.
Awesome. Yeah. And I think that it kind of was like Carmen said, it was brought forth to open the conversation, which it did. I mean, I looked at ACA 11 and I was like, okay, broad, very broad, which one of the things I know people have already asked me about was the income tax on the high earners, what that means. And I have ACA 11 brought up on my computer, so we can go into that for those who make above 150,000 a year. But ACA 11, it was kind of just to shut them up, like we know from the get-go that we didn't need this funding bill to pass AB 1400 to get those waivers. We knew we didn't need it, but we knew that also they weren't going to shut up until they had something. So this is, to me, I look at ACA 11 like a pacifier, right? That's kind of what it is. Betty, you said you wanted to clarify something really quick? Go
Yeah.
ahead, and then we'll come back to Maureen.
Sure, I'm sorry. I'm not, there's something I'm just not quite getting. I understand that with the ACA 11 for sure. I actually feel like we don't really even need to refer to them as taxes. And we could actually say that we get around the general fund by creating the CalCare trust fund, you know. So I mean, I get all that. However, if there are taxes that are going to be involved, we do have to deal with the GAN and Prop 98, right? So what I'm kind of a little confused about is that, is it an either or thing? Is it a 2/3 of the legislator voting and it becomes a constitutional amendment? Or is that what makes it able to go to a ballot, or it has to always go to a ballot for Californians to vote on? That's kind of like where I'm.
Okay, got it. I misunderstood. So first, the easy part, it puts it on the ballot. The 2/3 of the legislator passing it doesn't mean it's a constitutional amendment. It means it's before the voters. It places it on the ballot. But as far as Prop 98 and the GAN limit, there are other ways to finance a single payer system that can move around it. I think that this is a way of moving around it. And I think that it is a way that is good enough to get Anthony Rendon, Jim Wood, and a lot of the legislative leadership in the assembly to say, okay, this is a serious proposal. We'll move AB 1400 forward. I don't know if you all saw, but Anthony Rendon actually did an interview pretty recently, and he actually had some pretty positive things to say about AB 1400, which was cool to hear. So I think the thing is whether, like, they're definitely they're not going to admit that there's more pressure at hand here. There definitely is, but the reality is they're taking this effort a lot more seriously than they took 2017. So I think we've made a lot of headway that way alone.
Thanks, Ryan. And then Maureen.
Yes, thank you. Yeah, Ryan, I'm sure you remember, because you remember everything, but in SB 562, one of the approaches was, before the Perry report came out, was to say that, the issues with GAN and Prop 98 are with the general fund. And if you shift funds into a trust fund and not into the general fund, that perhaps the laws about 98 and GAN do not apply. And I believe, I haven't had time to research it yet, but I believe there have been times where various things that could have been considered taxes were not considered taxes because they were put into some kind of special fund, which may be why we have a $41 billion slush fund now in California. We have, and it's projected $31 billion for next year. A surplus, that's what I'm looking for, surplus. So anyway, what about that idea of that these go into a trust fund, so they're not real, they don't have to go into the general fund? What is that an option? What do you think?
Well, it's certainly an argument, and there have been cases decided both ways regarding this issue. Carmen, the people who are the brains behind these different measures, are certainly well aware, and it is a factor they consider as they move forward with what became ACA 11. But ultimately, ACA 11 was written the way it is, which it pretty explicitly exempts the trust fund from Prop 98 and GAN, more because it satisfied legislators who are skeptical of that argument. A lot, because that argument, if you remember, was made during 562, like Maureen said, and a lot of legislators just didn't buy it. Having something codified in ACA 11 that says, no, these revenues are exempt from these particular statutes is a lot more serious to them, that whatever the merits may be, than testing that legal theory. So I think that's why they ultimately went on. But it is definitely something that the people drafting these measures are well aware of. This is just the route they decided to go for the sake of getting things moving.
Thanks for that. That's so good to have Ryan on, going deeper into this than I would. Then we have a question from Robert.
It's more of a comment than a question. At the same time the car care event was going on in Sacramento, there was a Zoom call with a bunch of different organizations that are not healthcare related organizations, and they were mentioning AB 1400 and support.
So wait, can you repeat that? You were saying that at the same time we were doing the care event, you said there was a Zoom going on with different organizations.
From Sacramento that were not healthcare related organizations. They were mentioned in support of AB 1400.
So these, I'm sorry. So wait, these organizations were, you're just saying that they were just in support. So we had like more support outside of the healthcare folks. Oh, got it. Well, that's, I mean, it's making its way around. Like, as we're making noise and we're adding visibility to that noise, more people are starting to question, what is this? And then, the big conversation is labor. How does labor feel about this? How does labor do this? Well, I don't think I could do this because of labor. What about labor? And I'm like, granted, this bill was written by labor. Just putting that out there. But number two, while I'm a union member, I have to not only care about labor, I have to care about 40 million people. And I do. Not all 40 million people are under a labor union's umbrella. I'm up until July of 2021, I had never been under a union, never, right? I have worked with unions on the political front. I have organized with unions, but as was my employer ever unionized? Not until I just took this job that I recently took. So I definitely feel the whole concern from a lot of the politicians concerned about what labor feels about this. I reemphasize this bill was written by labor, literally CNA, and but I cannot just let that be my sole deciding factor, because I know that a lot of people in California are not covered under a labor union, and it wouldn't be fair to them to say, oh, well, I only made a decision based on what the union said. I'm like, this helps the unions, because one of the questions brought up in the health committee was, well, what are the unions going to use to organize with? Was that Jordan Cunningham that said that? He brought up this whole thing about, Lord help you, Jordan, Lord help you, thoughts and prayers. So if a union does not have to spend so much time negotiating their healthcare benefits, which is ridiculous, like ridiculous amount of time just negotiating healthcare benefits, maybe they can negotiate better breaks. 30-minute breaks should be completely just asinine. Like by the time you even get your food and sit down, you have to sit there and scarf your lunch. And California is very labor friendly. Other states don't even have the labor laws that we do. But there are so many other things that labor could fight for their workers for if they didn't have to spend so much time at the table just talking about healthcare. So to answer that question and to talk to the people who are concerned about what labor is thinking about this bill, I encourage them to think about what labor could do. And maybe that's what they're scared of. I mean, maybe they're scared. Labor did leaps and bounds during this pandemic as workers woke up and realized that, oh shit, like I'm being treated like crap. I don't have health care. I'm dying out here and you're making me work without a mask or some crappy little cloth mask. Labor is making leaps and bounds. So maybe the people who are concerned, who are saying that using labor as an excuse not to support AB 1400, maybe they're worried about what labor will do when they don't have to worry about their healthcare benefits and can go fight for bigger things. So I support AB 1400 as a union member because I want my union to go fight for other things. Like, why do I have to park a half mile away from my hospital? That is crazy. And I have to walk. So yeah, I should be going to my union about that. Anyway, I see there's a hand up. Let me just go back. I think I skipped a question from earlier. Before I come back around to you, Maureen, I'll come back. Let me just go make sure that I did not skip a question. We answered that one. Okay, I think I'm good. So yeah, we can come back. Maureen, go ahead.
Yeah, thanks, Jean.
Sorry, Maureen, I hit mute on accident. I was trying to lower your hand and I hit mute. Go ahead, come off mute again.
I'm sure plenty of people would love to have that capacity. Don't tell them how to do it. Yeah, regarding labor, first of all, the unions, there's only 2.5 something million union members in California with 39 million residents, right? 39 million people. But of the unions that have endorsed AB 1400, we have California Teachers, which is about 300,000. We have Unite Here, which is about 300,000. We have the nurses, which is about 100,000, and then several other smaller unions. So these are unions that are all endorsing. I think we have practically, 40% or something of the union leadership has already endorsed in terms of numbers of members. The only union I know that has really not supported, overtly not supported, is the National Union of Healthcare Workers. And I think maybe the machinists, I don't know, but they're very, very small. They have 15,000 members.
All the machinery industry and injuries, all the cut off pinkies and all that stuff, and they're not, never mind. Go ahead, Maria.
Well, and then there was another point. I mean, I think one of our messages has to be labor wins. I mean, the Milliman report came out and said that's a report that does a lot of actuarial studies on a variety of things, including labor and business. And they said the average American worker who salary at, I think it was 56,000, it might have been 58, but 56,000, the healthcare costs for that person through their employer for a family of 4 is $28,000. Now, 21,000 of that is premiums. The business pays, the employer pays 15%, the employee pays 6%. I mean, I'm sorry, 15,000. The employee pays 6,000. And I'm sorry, I've been at soccer games all day in Riverside. My head, I don't know. And then the remaining like 7,000 or so is out of pocket. So when you look at a salary of $56,000 and for a family of 4, $28,000 cost for healthcare, and it's increasing, it's constantly increasing. I mean, that's really outrageous. And the other part of that is in terms of bureaucracy. Jim Kahn did a study and found that about $1,500 per person is wasted just on unnecessary paperwork. And for a family of 4, that's $6,000 wasted money that's coming out of our pockets that, that money could go back into people's pockets and pay for a lot of things that they need. So to me, labor, and the other point about labor is the constant strikes. I mean, people are always, workers are always striking. They're striking here and striking there because they're being mistreated. And one of the ways in which they're being mistreated, as you know, is healthcare. They're paying more and more out of their pocket. So I think we need to push the narrative that this bill is a win for labor. And I'm sorry, and the third point is there will be jobs created. When you think about the restorative funding going into rural areas and urban areas that have suffered neglect over the decades and have not received the funding that they deserve, and so they've become healthcare deserts, when that money is restored and infused into these communities, you think about all the jobs in a hospital. You need janitors, you need electricians, you need plumbers, you need, besides everyone else you need in the business office, you need, food service. I mean, there's all kinds of jobs that appear. And in addition, jobs around a health center, around a hospital, and all the jobs when you add vision and you add hearing, and we add things like, walkers and wheelchairs. And these are all businesses that are going to need to hire more people because there would be more people actually getting their services. So this is like a win-win-win for labor. That's all I have.
And yes, thank you so much, Maureen. So yeah, these could be union jobs, but going really quick, looping back to the tax talk. The tax talks, I want to get into these last topics, and I know we've already burned up an hour, and I want to thank Ryan so much for hanging out. So the tax talk with AC11, which we've already talked about, but I just want to hit these key points. The cost people, and the reason why this isn't prevalent is because nobody really thinks, if you have employer sponsored healthcare, you're not really thinking, oh crap, I'm spending, $1,300-$1,400 as a single person a month, or not a month, but maybe a year if you have really good employer sponsored healthcare. Maybe even you could the thousands that you spend in your employer sponsored care due to your contribution. You're not adding that up per se and looking at that on a big the big picture, like yearly. I did it last year and I was like, oh crap, 6% of my of my income just went to healthcare, right? You're not thinking about those deductibles and those copays that are adding up. You're just being pinched, and it's like being pinched in different parts of your body. So someone pinches you on your shoulder, you're like, ow, that hurts. And then someone pinches you on your leg, and you're like, ow, that hurts. But it's not being pinched in the same space to where it's hurting just steadily. You're being constantly pinched in different places. So you get pinched one place, which is your every biweekly contribution to your healthcare, and then you go to your doctor's office and you get pinched in another place, which is your copay, and then you go to the pharmacy and then you get pinched in another place, which is the copay for your medication, and then you get a bill about a month later after the claim has been processed, and that's a pinch another place because you had that lab done, but you're so far off from hitting your whatever god awful high $2,500 $5,000 deductible that you didn't feel that pinch. So it's like pinches in different places. But let me tell you, you are getting you're paying a lot more than you would pay in tax, quote unquote taxes. And I'm going to call it what it is. I can't sugarcoat this. This is taxes. Yes, tax. The reason why you're pissed off is because you have not seen the fruit of your taxes. We get taxed a lot here in California. I don't deny that. I won't deny the truth, but we're not necessarily seeing it and feeling it, the result of our tax money, right? So you're like, I voted to, decrease homelessness by adding a tax, but then you see homelessness at like all-time highs. And you're like, I voted to do this, to, make sure we had all these, these different environmental protections. But then you see that we're constantly having leaks into the ocean. So I understand why people are going to be pissed off when we talk about taxes. But let me tell you, 1% is not the same as 6%. So paying 1% for a tax to provide healthcare, regardless of what you need, as long as you're having medically necessary care, the 1% that you may pay in a tax is not as high as what you're paying now with your employer sponsored care or care under Covered California. And so with that being said, I want to go to Betty, who has her hand raised.
I'm just full of questions today. So yeah, this is for Ryan, and I will piggyback on what you were just saying. Actually, I'm going to piggyback on what you just said, Gina, because I spoke to my neighbor today who actually works for the VA. When I was 2017, I love my neighbors. 2017, his wife kind of blew me off as if I was like one of those people that give out flyers on the corner. When I tried to give her an a SB562 thing, it was like laughing because I was like, dude, like, you live like 2 doors away from me. Anyhow, I talked to her husband today and he works at the VA and he's like, oh, I saw you put these up on, I had put them up around the, the complex. And I'm like, yeah, I know we're really in this, we're in kind of moving very quickly, and we need calls to our assembly person, because my particular assembly person is Jesse Gabriel, who is on the Appropriations Committee, who has given a pretty good nod that he will vote for AB1400. But I'm always like that person that wants to make sure with certainty that they are going to do that. So, get people to call in. Anyhow, I talked to him and he said he works for the VA. I said, well, it's not like the VA right away. I said, it's not like AB1400. This is for single payer. It's not like the VA because the VA is actually what you can think about as socialized medicine where the government runs everything from, the doctors and the facilities, just like it does in England. And this is not what AB1400 is. This is more like Canada and Australia and Taiwan and Japan, where privately delivered but publicly funded. Anyhow, speaking to the education of people, we start to get a little bit about, well, how much is going to cost type thing. And I told him, well, it'd be a 1% payroll tax. And he's like, well, what businesses? And I go, yes, it's going to be over $49,000 if you're making over $49,000. And, we got into this conversation and he said, and I go, and he goes, well, I go, will you call? And he's like, well, I don't know. I'll think about it. And I go, well, how much do you pay for your insurance right now? He's like, well, I pay like a little bit over $400 a month. And I said, okay. And he goes, $400 is paid by my employer, right? Because he doesn't have VA. They do private, he doesn't get his care through the VA. He works for the VA, right? So I said, okay. And I was like, well, I said, this, won't have any co-pays or deductibles. And he goes, oh, no co-pays or deductibles? And I'm like, yeah. And I go, and no premiums. And he goes, no premiums? And I'm like, I was just like, yes. I go, so that 1% tax that we were just talking about, that covers your premiums, your co-pays, your deductibles. And he kind of like, so this is the amount of education that we really still have to do with many people. But he did get part of it, and he was paying attention, and he did see my information out there before. But people are not understanding that they're in lieu of their premiums, they're paying the 1% tax, and their premiums are definitely a huge tax, like you said, a huge tax on them. So that gave him he just kind of went like a big light bulb I could see go off on him. Oh my God, I'm only going to have to pay 1% and I don't have to pay premiums and deductibles and co-pays. And I'm like, yeah, but anyhow, so just to ask Ryan, the question is, has anybody as sponsors, CNA as sponsors of AB1400, have you guys discussed anything or have any information about workers' comp and what that would do to workers' comp possibly? Like, will it take workers' comp off the table or for businesses?
So the specific interaction of AB1400 and workers' comp, I'm not going to say it remains to be seen, but it's more of the specifics of it will be hammered out as it goes through the process. However, what I will say is that workers' comp insurance that employers are paying is going to become a lot less expensive under AB1400 because now it's mainly wage replacement because now the medical aspect is gone. So I think that's actually a major thing that people who have a business but are concerned about the implications of a financing mechanism like HC4US, it's like, it's not just that you're going to save money in terms of how much you pay for your employees' healthcare if you do. But second, it's also important to note that that $50,000 mark that you mentioned just now, Betty, that's marginal. So it's not like the people who are making like $55,000 a year are going to be having a flat 1% tax increase. It's a 1% tax increase on earnings over $49,900. So that's when the threshold kicks in. We've always talked about marginal versus absolute tax rates. So that's marginal. So that's an important thing to remember too. But also, it has a bunch of other benefits for businesses also. Because think about it. If I'm a small tech startup, how am I going to attract the best talent if Google is in my neighborhood and is offering the smartest people much more money, plus the world best health insurance money can buy? That's one less thing I have to compete with as a business, as a startup small business, if I no longer have to worry about using healthcare to bring people in. There are so many arguments for how this would be game-changing, specifically for small businesses who are exempt from most of the taxes that this would levy on them. So most small businesses wouldn't pay the gross receipts tax, for example. That's a that has a 2 million exemption, just like the Pollins financing mechanism did from SB 562. And the payroll tax, the employer share, it's only on employers with 50 or more employees. So most small businesses would not be paying much, or if at any, of these tax rates. So I think it is absolutely going to take really clear business-focused messaging on that front. And there is a lot of it.
And yeah, and I just wanted to add, I thought about another industry, the cannabis industry. A lot of the cannabis industry are individually owned businesses. They're small and they will be, they won't have to pay these taxes. Because that was the thing. I talked to someone who was in cannabis and he's like, I'm already getting taxed to hell based on the proposition we passed for California. And I was like, well, actually, you're going to get healthcare, right? And, healthcare for your employees, you won't have to worry about that. I don't know how many people have had small businesses that are wanting to grow, but can't provide healthcare to their employees. They lose employees to bigger companies because a company can provide healthcare and they can't. And on top of that, a healthy California is a productive California, and a productive California makes that little thingy, the stock market thingy go up, whatever thingy, that thingy. So that is what a productive California does. But a sick California continues to make the thingies go down, those thingies. Those go down when California is sick, okay? And when California is sick, as we know, we have a lot of economy going on here. When California is sick, look at what happened at the docks. Look what's going on in the Port of Long Beach right now. When California is sick, the whole country is sick. So we don't need to be California to be sick. But another thing I was going to say about the taxes is that actually, and this is going to be some reverse psychology, businesses win, even big business, because they really get extorted at the negotiation table by private insurers. I'm not, like I said, I'm not coming for big business. I'm not a supporter. Don't think of me as the spy for big business. I'm not. But they actually pay a lot. I was looking at my check stub and I was like, okay, well, I paid $109 for my Anthem PPO insurance. My employer paid, I think, $550 of that. So my contribution was $109, theirs was $550 on one pay period, one pay period for me, Gina, sole person here. So imagine how much, that's $550 for Gina that they get to keep in their little happy pocket and hopefully can move my parking space a little closer. So, so that's what I'm saying. Even big business could win on this. And I know that they can't see that picture right now, but it actually is a big win for a big business that's not affiliated with an insurance company. So go ahead, Ryan, we're going to
If I could, there's one thing, because a lot of them do know this, but it's what I just mentioned earlier that that big business enjoys about the current system, which is social control. Again, if you're Google and you have the ability to pay for the world's best healthcare, you're willing to eat that if it means you're getting the biggest and the best and the brightest talent. It's hard to leave these companies unless you are like the top of the top in your respective field and you can get a job basically anywhere. You have the access to all of the best employees at every level if you can offer them the best benefits. So money isn't an issue for the Googles out there. Obviously, for the medium-sized businesses, you're absolutely right. That's a big deal. But I don't think we should be expecting the Fortune 500 companies to be excited for this because they love the ability to buy the best talent by paying exorbitant prices for the best, most comprehensive healthcare that money can buy under our twisted for-profit system. So I absolutely think that we need to have a focused message, but we also need to be realistic about the fact that single-payer healthcare takes away the power dynamic from the boss and gives the power to the worker. Now, that's great for unions. That's great for the working class. Not so great for Jeff Bezos.
You know what? Once again, Bezos, if you're out there, we can fix this. Like, I am open to negotiating. We can fix this. I am willing to forgive if you help me with this bill. Help me pass this bill. Take Newsom to French Laundry. I don't care. Just help me pass this bill and I will partially forgive you. Anyway. Okay, so let's go to Maureen and then we have Robert and then we're going to move into our next topic here because I don't want to get too hung up on the tax talk, but I did want to just give you guys a little bit of ammunition, which I know a lot of these talking points you guys have heard, but I want to make sure that you guys are confident in them when you go up against these people because we're already hearing it from the ground. The news is running with the tax talk. And so all of our bigger organizations, anyone on board with this, we just have to defuse the bomb now and not wait for it to go off because if it explodes, well, I don't want to be around when it does. Go ahead, Maureen. And then we'll go to Robert.
Back up what Ryan was saying in that the system we have now is an obstacle to innovation. And in Europe has a far greater percentage of entrepreneurs actually than we do in the United States. And their entrepreneurs are younger. Our entrepreneurs tend to be older. A lot of them, after they retire from their job where they had healthcare and they're on Medicare, and then they can finally pursue some of the ideas that they had and they've always wanted to, to research or to implement, but they couldn't do it because of the healthcare. So I think that's kind of an important thing, that what we have right now is an obstacle to entrepreneurship and to innovation. And then I have a quick question. Maybe this isn't the time for it. I don't know, maybe later, but I don't want to lose it because I really don't know it. And it was for Ryan. This appropriations hearing has been labeled as what, a closed session? What does that mean exactly?
So it's not like a formal thing. I don't remember if I said those words or not, but if I did, I just mean it's not going to be a public hearing.
Yeah.
The decision on whether the bill AB 1400 will be released from appropriations is going to be made in private. We will not see how the decision is made. And the only thing we will know is if the bill is released, we'll know if the Democrats are the only ones who voted to get it out in that closed meeting, if you will, or if everyone did. In reality, no Republican's going to vote for it. So again, the only two realistic scenarios: gets out on a B roll call, meaning that Democrats are the ones who wanted it out, or held in committee, in which case, game over for the year.
How does that get decided? I mean, it's so undemocratic that the people cannot see what their so-called representatives are doing. How is that decided? That's like really an outrage.
There are articles about this that I encourage people to look up. Just Google Assembly suspense file and you'll find a ton of stuff. But what I will say is that, yeah, I do have strong opinions about the entire suspense file process. I think that the issue is that the Appropriations Committee is the one-stop shop for every non-budget fiscal bill, which is thousands per session. So they're not going to have an individual hearing for every single bill. But this is definitely not the ideal way. It's decided by Chris Holden and a few other members of Assembly leadership, sitting down, going through the stack of bills and deciding which ones that they want to put up to be released and which ones they want to keep. And stakeholders will weigh in. You all are doing that through your letters, but the ultimate decision, we will not see who says what or how. And it's great. It's great. And by great, I mean, it's awful, but we play with the cards we're dealt, and we're dealt a meh hand here. So just use that as motivation to get everyone you know who's part of an organization to get their organizations to send letters in ASAP. Because again, that's how we get, that's how we can't call in and put pressure in by overwhelming them with call-ins. We can by overwhelming them with letters from organizations throughout the state of California.
This sounds like the Russia I was warned against in the 1950s, that we didn't want the United States to become Russia and have all these secret deliberations, that decide our fate. This is really an outrage.
And that's what's happening, unfortunately, to our great democracy that we love so much. Anyway, let's go to Robert, and then we'll go to Chang Sim, and then we'll go to our next two topics. And we have about 30 minutes left.
Ryan, so I'm assuming that big corporations would benefit also, because my sister works at a Walmart.
So actually, I will add, so Walmart, due to their lovely wages they pay their workers, being very, very sarcastic with that, Walmart will stand to gain once again, because their workers, at least in California, would have health coverage and could go see the doctor. Now, this does not fix the fact that they pay their workers very low, but their workers would be covered, and they would not, even for their full times, not have to contribute to their health care. Now, that would not solve a lot of the problems we have with Walmart, but I do imagine that they would probably see some profit off of that. But even though California, or at least the coastal cities of California, I would say inland is different. The coastal cities have fought off Walmart pretty heavy. But, I do believe that the people will gain the most by having access to good quality, equitable care. Where there are a lot of Walmarts are in rural areas, Inland Empire, Moreno Valley, all those places inland where they actually are still having underserved areas of healthcare would stand to benefit a lot from AB 1400, because we would be bringing better health care and resources into these areas. So yes, I think that Walmart would gain because they would not have to pay out for the employees they do cover for healthcare. And then, but most importantly, the people will gain access to equitable healthcare, not just crappy little rural clinic care. We're bringing good care. The same care I get here in West Los Angeles, that should be very similar, if not the same, healthcare that you should be getting in the Inland Empire and in Riverside and in places like that, where I hear my patients every day say, well, yeah, you know, I have to come out here because the clinic where I'm at is just so crappy. I see patients from places like Lake Isabella, where the doctors actually drive in from Bakersfield to see patients over in Lake Isabella. And I was told recently by a patient that the doctor's not going to come to Lake Isabella anymore, leaving them without this specialty, without nephrology. And they'll have to go to Bakersfield to see a nephrologist or specialist for their kidneys. A lot of people up there are poor. This is rural areas. And this is where this is who we're fighting for, right? We're trying to get people that equitable care. Sorry to go off on that tangent, Robert, but to answer your question, I think yes. All right, and then Chang Sim.
Hi, I just have a comment rather than a question, and it has to do with the question of taxation. I think movement can win if we are defensive in the face of fear-mongering about public taxation. I think we need to take the offensive and not run away from the taxation argument. And, you know, when people throw that, oh yeah, taxes are going to go up. And I think our answer should be flip that argument back at them. Yes, we are being overtaxed. And we are being overtaxed by the insurance companies because the premiums, copays, deductibles, co-insurance are all different names for poll taxes that we pay to private for-profit insurance companies. So we are being overtaxed by insurance companies. And what CalCare will do is do away with all these exorbitant private poll taxes and replace them with lower public taxation, which will result in net savings for the vast majority of California residents, and at the same time expand healthcare coverage for all. So I don't think we run away from this taxation thing. We flip it back at them and say, yeah, you know, we are being overtaxed, but the taxes are going to line the pockets of the insurance companies' executives. So what CalCare will do is actually lower your taxes and expand your health coverage. Make it short and sweet like that.
Well, exactly. So that's the reason why we're having this conversation. That's why I called this segment Diffusing the Tax Bomb, because we're exactly what you said. We're not running from this conversation. We're going to diffuse it. We know the bomb is there and we're not going to run away from that bomb. We're the bomb squad. We're here to diffuse the bomb because I don't want that bomb to go off. I see it already going off in the media because last week when AB 1400 was making mainstream media, that was what they were talking about. They weren't talking about, oh, it was universal health care, then taxes. They didn't talk about what was in that universal health care. They didn't talk about how it actually would be less cost on the person, the individual, than it is now. They said was universal health care, then taxes. So now subliminally, because I think the media is just doing one big psyop right now, which don't get me started, I'm going to sound like a conspiracy theorist, but it true is psychological warfare on our brain and our thought process, because when you see universal health care and you're the average person and you saw on the news that it immediately started talking about taxes, that is what you immediately start thinking. And so that is truly unfortunate that we are at the whim of our media, who are not doing good journalism right now. They're doing it for the ratings and the clickbait. But nonetheless, we are each individual person here on this call and who is watching on Facebook. That is the reason why we're having this conversation, is to diffuse that tax bomb. And to simply be put, a 1% tax is far less than what they're paying now with employer-sponsored care, unless you have like You're having the government sponsored care, which is if you are under that and you're opposing this, then shame on you, because you are literally preventing the same people from getting the access to the care that you have. Now, there are problems with the current like Medicare, Medi-Cal system, which we're going to also fix that with AB 1400. But if someone is telling you, well, I have Medicare, but I oppose this, I have to blatantly say, just shame on you. Because you're hoarding a resource away from people. And anyway, I'm going to go into this next conversation really quick. I want to talk about something I call reimbursement discrimination. And I thought about this as I was kind of working. And just for those who don't know, I do clinical case management. I'm kind of your liaison between the nursing world, which I am, and then the insurance world, which I fight, and then helping you navigate that, all of that, and helping you understand it. So I am unfortunately that person that tells you, oh yeah, your insurance will only pay 20% of this. And I know you said you wanted this equipment, but I found it cheaper on Amazon. Every single day I do that. Every single day. You can look at my Amazon list because I pull up my phone and you'll see like bedside commode 1 million times, shower chair 1 million times, because Medicare doesn't cover shower chairs. It doesn't. It's not a covered benefit in the DME. So just putting that out there, Medicare. That's why I said Medicare as it is now, AB 1400 is way better. Because if you need a shower chair, a physical therapist saw you, evaluated you at the hospital and said, for you to shower safely, you need to have a shower chair, then guess what? That should be covered. That should be covered. For you to shower safely, you should have a shower chair. Okay, cool. Recommendation, doctor get the order, we fulfill the order, done. But now it's, oh, well, that's not a covered benefit because it can be bought over the counter. And I'm like, oh, well, that's why I'm dealing with Amazon and Bezos. So I want to talk about reimbursement discrimination because as AB 1400 will level the playing field, it will get rid of the classism that's going on in healthcare. And the reason why I say that is because there are different rate payment structures. And I'm not going to go too far into this because I can't even get that deep into it, because it is literally the spaghetti bowl that if you've been watching us for a while, you'll see Dr. Bill, it's a bunch of lines and all this stuff pointing to different payments. And it is a true spaghetti bowl. But I want to just talk about 3 different things. So you have Medi-Cal or Medicaid here, you have Medicare, and then you have your regular PPO HMO insurance, right? Which is usually employer sponsored. And or if you purchase it yourself through the marketplace, which is not as cheap as people think. It's not as cheap as Washington, D.C. thinks either. So with that, it depends on the type of insurance you have. So let's say, and we were talking about this a little bit before I think we got started. Medi-Cal rate payments are typically the lowest, right? They pay the lowest because it is a public, it's publicly funded, is for low income. Their payout to the providers isn't the highest. Then you have Medicare, which is kind of like a good kind of like, payment. A lot of vendors, a lot of places like Medicare because it's guaranteed payment. And Medicare usually doesn't deny too much payment unless it's something that's not medically necessary or completely asinine. Like getting a Brazilian butt lift under Medicare is not going to happen. Okay, that's going to be a denied claim. But it has to be something that crazy. Or dental work. Unfortunately, dental is not covered under Medicare unless it's a medical emergency like oral maxillofacial surgery. Unfortunately, I see it all the time. Grandmas who have their teeth rotted really bad and have to come into the hospital for actual oral surgery, then Medicare will cover it. Isn't that crazy? That could have happened in a dentist office, but instead it had to rot. They couldn't eat. So now they have failure to thrive because they haven't ate. And I don't know, God knows how long. And I see this all the time. God knows how long they haven't ate. So they're really underweight and malnourished. And for an elderly person, that is very, very dangerous because being malnourished as elderly, you lose muscle strength like that. And then you might need to go in a nursing home for rehab. So then, you come in and your teeth are so rotted. So now you have an infection deeper in. And now it's in the bone. So now you have to be on antibiotics. And then you have to go into an oral maxillofacial surgeon for surgery to get those teeth taken out when you could have had your dental benefit, which you would have had under CalCare to take care of that situation when it would have been a mere cavity. Instead, it had to go full-blown maxillofacial surgery to an elder person who is having issues, or their dentures don't fit. That's another issue. Anyway, I'm going off on a tangent. So then you have PPO HMO insurance if you're a network. which pay a higher rate. So the reason why I say reimbursement discrimination is because let's just say for a clinic in XYZ area of Los Angeles says it sees Medi-Cal patients, it sees all patients, it takes all insurances, whatever. But let's say I have Medi-Cal and I call that provider and say, oh, I need to, I want to see this provider. I need to, for whatever, to primary care. And they're like, oh, okay, well, we're really booked out. And so, oh, you have Medi-Cal. What insurance? Oh, you have Medi-Cal. Okay, yeah, we're really booked out right now. But, we can see you, maybe in March or April. And that's not, I need to see a doctor sooner than that. So I'm like, okay, I go try another doctor. Now I have Medicare. So I call the same doctor's office. I have Medicare. And they're like, oh, what insurance you have? Oh, I have Medicare, A and B. Oh, okay. You know what? I think I have an opening for you in about a week and a half. Is that okay? But you told the Medi-Cal patient you didn't have openings until March or April. Rate payments. The rates for Medicare are higher than Medi-Cal. Now, calling again. I have my PPO. I have this beautiful Anthem insurance plan. And so here I go again. Hi, I need to make an appointment. And then they look and they're like, oh, okay, you have Anthem. Well, I might get pushed out. And even though Anthem and private insurance typically pays higher than Medicare, their reimbursement timeframes are crap. And the offices have to fight the private insurers a lot more than they do with Medicare. So that's why Medicare, even though their Medicare rates may not be as high as the PPOs and the HMOs, they don't have to fight as hard to get paid. So that's why they may want to see more Medicare, because it's more guaranteed payment versus having the PPO HMO, where you might have to fight if you didn't put the 0.007 on that CPT code. You might have to fight that claim. That claim might be denied. You might have to have the doctor go call the medical director of that insurance company now to do an appeal because you didn't put that 0.00 something on that CPT code. Whereas Medicare, not the same, right? Medicare, more or less the, kind of more guaranteed payment. Oh, guaranteed payment. That's kind of like what we're trying to do right now with AB1400, right? Guaranteed payment, right? So that's what I wanted to talk about, reimbursement discrimination. That is what's happening in practice. Nobody's going to admit that. There has been some people have had their hands slapped, if been caught, been blatant with it. But if you're not blatant with it, then they won't catch it. They don't even, I think actually in the health committee, they were talking about a Medi-Cal independent review committee. I'm like, just now you guys are talking about that? But anyway, so that is what's happening. I have witnessed it. I've had to participate in it due to my employment. But I am not proud to admit that, but I am proud to share it because I want people to know what's going on. Every time that they say this BS about, well, Medi-Cal, providing Medi-Cal to all the immigrants, that's great. We're providing them access to care. Going into my next topic, access versus guaranteed.
Gina, can I say something really quickly?
Oh yeah, jump in.
So when we talk about tiered healthcare and we talk about medical disparities in the state of California, let me make something really clear. California's Medi-Cal Medicaid program has the second lowest reimbursement rate of any state in the nation, behind only Rhode Island. And where are a disproportionate number of Medi-Cal patients congregated? Well, they're in two places. They're in rural areas and they're in very, very highly densely populated urban areas. What are the two areas that have disproportionately the lowest quality care and the lowest access to care in the state? Those two areas, it is not a coincidence. When we talk about ending medical apartheid, which I think is an amazing term, that is what we mean. When we talk about ending tiered healthcare, that's what we mean. It is not a small deal that AB 1400 would put everyone in the state, Governor Newsom, Gina, myself, and I don't know, who is the most powerful person that lives in the state of California? Whatever big celebrity that lives in California, they all being under the same healthcare. If Bezos lives in California, that's a big deal. If everyone gets their healthcare from the same plan, from Jeff Bezos to me, then that plan, one, is going to be more equitable, and two, will not be subject to political sabotage. Because you think Jeff Bezos is going to be happy sabotaging a program he's required to participate in? Or him, I guess it doesn't matter, but you get the point. So this is a big deal, that ending that sort of tiered healthcare, which, by the way, if you ever if you ever need an argument as to why, by the way, full disclosure, it's not a bad thing that Governor Newsom is expanding healthcare through Medi-Cal, not at all. Under the terrible system that we have, making it slightly less terrible in the meantime is not a bad thing. The problem is that he's trying to use this as a shot across the bow, as Stephanie Roberson, our GR director, called it, against AB1400. They're not the same thing, and it was intentionally done to confuse people. One of the major reasons they're not the same thing is you're not eliminating medical apartheid by expanding the, if you will, the lowest common denominator insurance in the state of California. It's good, it's better than nothing, but it's definitely not AB1400.
No, and then to add to that, so he expanded access, like Ryan said, very much so. Cool, great, good. I'm glad more people have access to care, but you gave them access to the shittiest system that already was underserved, under-resourced, and grossly understaffed. I know that from experience, because why Gina hurt her back some years ago, was off work 16 damn months, thanks to the shitty workers' comp system, by the way. And after 6 months after my short-term disability ran out, I had to go under COBRA, can't afford COBRA. So I went under Medi-Cal. And under Medi-Cal, I lost my access to all my UCLA physicians, all of them. I couldn't go to none of my UCLA physicians because I had Medi-Cal at the time. So I went to some crappy, I don't want to say crappy, and the doctors aren't crappy. Yeah, they are. This doctor was pretty crappy. And he was just thinking that I was another person from urban LA or South LA that didn't know my toe from my finger, and he could talk to me any which way. And even after I just had to reveal I was a nurse, he still thought that I was just like undereducated. I did not have a good experience while I had Medi-Cal. And it was until I went back to work that I got my PPO insurance. I like witnessed it right here in California. So to say that, granting the access to immigrants, that's great, but what about the resources? Because we know where a lot of immigrants live, in either rural areas or densely populated urban areas. What about those clinics? What about those doctors? Are we staffing up? Are we offering the resources to those clinics right now to increase, since they're going to have an increase in patients? What are you doing? So no, that's the thing. It's like you did them a service, but then if they can't get in for months anyway, did you do them a service? You just gave them access, and which I want to go to Robert, and then I'll come back to why access versus guaranteed. Robert, go ahead.
No, I have Medi-Cal, and one of the problems I have a lot is I get a prescription for high blood pressure. I go to the pharmacy. Oh, you're a health insurance company. Well, doesn't want to cover it. So you got to go back to the clinic. Then they got to verify with the health insurance company.
Correct, because it's you have Medi-Cal through a health plan or a medical group, right? It's not just Medi-Cal, huh?
After Blue Cross.
See, there you go. So you see how the major insurance companies have weaved themselves into our public insurance, our public coverage as well. And then they bottleneck. They have the nerve to bottleneck by doing things like that. So if that medication was not covered or it wasn't in their formulary and the doctor didn't think to go through and look at it, that's what I do. So when I have patients going to discharge from the hospital, I have them, and thankfully I work at a hospital that has really good resources. I have the doctors already send the prescriptions over so I can see what's going to go through and not, and then I can see what the copays are. So I can go ahead and start that fight before. So if I need to jump on the phone to the insurance before that patient leaves the hospital and gets to the pharmacy, I do, because what happens is, in the case of Robert, tons of patients get to that pharmacy, either the copay is really high, it is not covered, or it needs prior authorization, which is going to delay that medication from being given to the patient. And sometimes they don't come back for it. Tons of patients have gotten in super infections, which is an actual thing, because they never took their initial antibiotic because of these reasons. Blood pressure medication, that is at putting a patient at risk for stroke, all because, the insurance. So why is it that the insurance gets to put a patient like Robert at risk of stroke? If he would have had open Medi-Cal, probably not happening, but to have just regular, I don't even think it's not offered very often, if any, in Medi-Cal now. You have to, I think, choose a plan. Robert, correct me if I'm wrong, but you have to choose a plan, right?
They gave you a choice of few plans.
Yeah, so I think you have to choose a plan to be under Medi-Cal now. I don't think it's just Medi-Cal. You can't just have open Medi-Cal. And so it's like, for me, I have to choose LA Care. So, you know, that's the craziness that's going on right now. This is the medical apartheid going on right now. And it is so confusing that the average person will not, honestly, it's hard for me to understand. And then just really quick, I see a question from James off of Facebook. How do Medi-Cal rates compare to Medicare? Simply put, they're a lot lower. That's why Medi-Cal always gets put to the bottom, because they're lower. And like I said, and the payment, sometimes it's a little delayed. It's ran by the state. The fee structure is determined by the state, honestly, because this is a more state funded. You get some federal funds for Medicaid and CHIP, but it's more state funded than it is fed, like Medicare. So it is lower. And that is the reason why you see the reimbursement discrimination, this medical apartheid going on. And so, you know, it's really kind of a sad thing. But then lastly, I want to just go into, as we're in our last 15 minutes, and then I'll let kind of Ryan have any closing thoughts. I want to talk about the guaranteed versus access, right? So Gina has access to a Bentley dealership. I live in West LA. I know they're around here somewhere. I have access to one. I can get in my car, which is a Kia, and I can drive to the Bentley dealership, and I can go look at a Bentley, and I can go talk to the dealer, and I can do everything I need for that Bentley until it's time to pay for that Bentley. Because I don't have the guaranteed $100 and something thousand to pay for the Bentley, but I had access to it though. I have access to the Bentley. Now, if I had a guaranteed Bentley, that means I drove to the dealership, I picked out my Bentley, I showed them my CalCare card. No, I'm kidding. but having a Bentley guaranteed is different from having access. So having access means that, yes, anybody could go to a physician's office. You have the ability to go to a public hospital or anything like that. You have access to it, absolutely. But when it comes to paying for that service, getting that bill, that's the difference between access and guaranteed. We are trying to guarantee you your health care by saying that if you are sick, if you need medically necessary care, if it is time for your annual physical and you need to go to the doctor, we are guaranteeing you that you will be able to do that and not get some absorbent bill. We are not saying that we are giving you access to that. We're not giving you access to just going there. What they're saying is, oh, we gave everyone access. Yes, you did. You gave everyone the ability to go to a doctor's office. Good job. I'm guaranteeing that when you get to that doctor's office, you're going to give them your CalCare card. Your doctor's going to see you. If you have to get prescriptions, he's going to write those scripts. You're going to walk out. You're going to go to the pharmacy. You're not going to experience what Robert experienced. That pharmacist is going to fill those prescriptions. You're going to wait for them to be filled. You're going to go home. That is what I'm guaranteeing. Access versus guaranteed. Ryan, any final thoughts? And then, or as I look for anybody have any final questions?
There are no questions, then the last thing I'll say is this. The single payer movement has come a long way in California. The bill itself did not move until recently. And the bill was introduced in February of last year, and it was basically stuck in neutral in the Rules Committee until ACA 11 was introduced. But I don't want y'all to think that nothing was going on during that time. There was a lot of movement building going on during that time. A lot of people were reached out to. A lot of people were brought into our movement. And when the time came to put the pedal to the metal, we got AB 1400 through the Health Committee. We had to do it on occasion kicking and screaming. There were quite a few legislators on that committee who probably were not super thrilled to be voting for that bill. We know that at least 2 of them said that they probably wouldn't vote for it on the floor. That doesn't mean that it's over for in the case of those 2. They can always change their mind. But the reason I bring this up is that we are in a better position. I know SB 562 cleared the Senate, but I think that we're in a better position this time, even though the bill's only made it through one committee. I think that we have generated a lot more pressure this time under much more harsh circumstances under the same leadership, by the way, that, in terms of Anthony Rendon, where 562 died. This bill is moving forward, and Rendon is now saying positive things about our bill. That does not mean we're guaranteed to win. It's still going to be a massive struggle to clear appropriations, clear the assembly, and then go through the entire process again in the Senate. But we can win. I strongly encourage people to join us in our phone banks. And if you're not doing work with us, find someone else. There's a ton of groups doing single payer work in the state of California. The different DSA groups are doing great work. You have different Dem clubs, if you're in the Democratic Party world, that have taken the leadership while the state party hasn't. There are different ways to do things. If you belong to a Dem club, by the way, they'd be great to get to send a letter in, by the way. And it's a very low bar ask because it's not like it's those, they tend to be more supportive than the party at large, but keep the work going, pedal to the metal. We're still in an all-out sprint right now. We've got 14 days to go and until we know for sure what's going on. We have till the end of the month to clear the assembly. It's going to be hard as hell, but I think we can do it. So let's keep up the good work, everyone. And I'm really, really privileged to be working with all of you on this because, again, like I said at the beginning, we wouldn't be where we were if your activism weren't in play. Your activism and everyone in the state of California that has been fighting like hell this entire time. And I think we can do this. I believe that we'll win.
Thank you. I see a hand up from Jeffrey.
My comment simply is that as soon as we get it through appropriations, is every single legislator needs to be called to get it on the floor voting for this. And they need to know what it's about.
Absolutely. And that's why we built a statewide coalition with, helping with the resources of CNA and, Healthcare for All LA. Like, we have built a statewide coalition so that when we are ready to go, we have people from district. I mean, we pulled Jim Wood. I mean, we were plotting on Jim Wood from day one, but, it was really his district that pulled him. And he had mentioned that. So, we pulled Jim Wood. So our power is there. So when we're ready to go, we're going to go. And yeah, we're playing nice and we're doing high road ask. And I would say continue that, going through the committees and going through to the assembly floor. But when we are ready, we're going to activate the entire state. All 80 districts has a CalCare or AB1400 activist group somewhere. It could be 2 people in the most rural areas, but it doesn't matter because those 2 people made a hell of a lot of calls. And so, we have all 80 districts that can be calling their assembly members and getting on their head about it. So in a short period of time, the problem is that now we don't have a lot of time to really strategize because we're moving so fast. So we're going into appropriations. We just learned the appropriations process because it's so undemocratic and so hush hush because everything's held in suspense, literally, we didn't even know about it. And now it's like, and as soon as if we get out of appropriations and not held in suspense, then we're going to go straight to the floor. And then that's when we have to activate. We don't know when that vote's going to happen, but as soon as we know, we just have to keep doing it. And so keep talking to your assembly members. And like I said, if they're on board, thank them, tell them that you've got their back, send them a cupcake, whatever. And if they are in an opposition, calmly ask them, well, what are the issues that you're opposing right now? If it's financing, ask them, well, have you looked at ACA 11? See if they'll give you some genuine, have a genuine conversation with you and then come back and tell us what they said. Seriously, I just want to know. And so those are the key things. Also, lastly, I want to do this on behalf of CNA. If you guys haven't heard, they just recently changed the guidelines for the nurses about basically saying we could be COVID positive, and as long as we're asymptomatic, we can return to work. I don't agree with that. I'll be honest. I told my coworkers, 2 of which have babies, that even if I test positive, I'm staying home. I have a I coughed, so I'm staying home. But there is a petition that they have to try to get the governor to rescind that. I'm going to drop the link in the chat. And if Paul, you can drop it on Facebook. We need to support the nurses. I'm affected by this. A lot of nurses and healthcare workers, not just nurses, healthcare workers are affected by this, from your environmental service all the way to your dietary, to everyone who's affected by this in the hospitals. We should not have to come to work if we are COVID positive, whether we're symptomatic or not. We need to keep our coworkers safe. We need to think about more than ourselves, and we need to think about more than profit. I understand that they're trying to keep the healthcare system from failing, but this is shame on all leadership right now, because we could have avoided this. Any doctor, any nurse, any infectious disease epidemiologist would have told you we had a surge coming in the fall. I knew flu-rona was coming in the fall. Why? Because flu season was going to pop up and COVID was going to surge because of the holidays. That doesn't take a rocket scientist. That didn't take anybody above like my little nursery knowledge to know that was going to happen. But did they prepare for it? No, not at all. So that is why I'm asking you guys, please sign this petition. We should not have to work if we are COVID positive, whether we don't feel good or not. We should be able to stay home until we have outside the quarantine or isolation period. All right, I'm off my soapbox, but I do want to help CNA with that. I know they've been pushing it pretty hard.
Thank you, Gina. That's really important, because remember, if your nurses aren't safe, you're not safe.
Not at all.
So please sign that petition. Thanks so much again, Gina, for bringing that up.
No problem. Thank you. So, and just a couple of more announcements. So this is MLK Day weekend, and I know I was just talking about COVID, but there are a couple of outdoor COVID friendly events that I know the links are being dropped right now for the MLK Day care event here in LA. And then, please make sure you get those letters in ASAP. If you are a part of an organization, write it tonight, get the okay from the organization leadership if that hasn't happened already, and get it in tomorrow, because we are going into committee, I think, towards the end of this week. Anything else? Maureen, Betty, do you guys have any other announcements? I have a few minutes left, and then we'll hop off. And thank you guys for joining.
I just want to add on to your announcement, Gina, that yes, there is a Martin Luther King Day parade. For those in Los Angeles, you might have heard that it was canceled. Actually, the corporate, which is usually sponsored by health insurance companies, was canceled. But the grassroots caravan will be moving on. The grassroots march will happen, but it will be a caravan for safety. And it's happening tomorrow. And we will be assembling at 10 o'clock. The caravan will be at 11 a.m. We're assembling at Western Avenue and Martin Luther King Boulevard. And it's and we are the healthcare contingent, which will include healthcare for all Los Angeles, single-minded for single payer, Feel the Burn San Fernando Valley. We will have a stake bed truck and a DJ. And we will be doing our Staying Alive CalCare dance. So we do need dancers. So if you can join us, please come and meet us. If you come be there at 9:30, that'd be great. We'll practice the dance and we'll do that march. But most of us will be in cars, and hopefully we have enough placards, but bring some stuff for signs and that kind of thing, and we'll give you slogans.
Awesome. Thank you. I wish I could be there, but going back to the whole petition thing, I actually have to work tomorrow. It's my holiday, but I have Juneteenth off, so that's a good one. Anyway, so Jeffrey, you have an announcement, and then we'll wrap this up.
The announcement is that AB1416, which was dealing with the ballot proposition for clean money, passed through the election committee last Wednesday. So it is on its way, and this is just trying to get on each ballot who is strongly in support and against the propositions and the measures. But it has passed through the elective committee through there. Just wanted to tell you that.
Oh, thank you so much. I did talk to, because Isaac Bryan is now the chair of that, and I did talk to his staff about that last week and support. This is a big deal, because if something, for some god awful reason, we have to go to the ballot with AB 1400 related entities, then this will make a difference, because then we'll show Blue Shield's ugly face. Then we'll show the big insurance ugly face on why they're supporting this and who's not. So I supported this because I think it's good to show who supports a proposition and who doesn't in the ballot guide, hoping to God people look at it. All right, guys. Well,
there's one last announcement.
Okay, go ahead. Really quick.
That is January 24th. Healthcare for All is hosting Wendell Potter.
Oh, yeah, that's a big one.
Yeah, 7:30 to 8:30 p.m. in the evening. And if you go to our website, Paul, I hope you'll drop that in the link, in. But for those who are just listening, you can go to our hcala.org website and go to events. It should be there, also on our Facebook page. And if you're going to do this, you can, it'll be live streamed on Facebook, but if you're going to do the Zoom, you must RSVP. So fill out the form to RSVP. So that's Wendell Potter, Monday, January 24th, 7:30 p.m.
And just, yeah, I saw a question from, is it Taiji in the chat? Who is Wendell Potter? So Wendell Potter is a former big insurance executive who came over to our side and is spilling all the tea. He's doing what I do, because I mean, have a very similar background, except he was way higher up the chain with the plans than I was. And so he spills all the tea. He has become an activist for Medicare for all and for single payers. And so it's big for him to join us. He has a good insight on how big insurance works. He gives us a lot, like I said, gives us a lot of insight and a lot of talking points to counter the conversations coming out of big insurance. So Wendell Potter, please join us. It's going to be a good conversation. I'm going to love to hear what he has to say. All right, guys, I want to thank you so much. I thank you for hanging with us for a couple of hours. This is heated. We're going to make big changes. Each and every one of you guys is supporting and carrying California on your back. We are going to make California a truly healthy California. We're going to give them AB1400, and they will have CalCare, whether they like it or not. Anyway, and then hopefully we will start seeing the love. I hope the governor has seen part of this or part of our talks and has seen how passionate each and every one of you are. Thank you, Ryan, so much for joining us, especially last minute to ask. I love how you and Phil are always there for us. And thank you to CNA supporting the nurses and the nurses being supported by us. You guys have a great night. You take care and stay well. Bye, everyone.
Thank you, Judith.